in Canada. I would also like to mention our co-authors, Dr. Elizabeth Savick, who is also the PI of this project, Mauricio, who is our research associate at SARAVYC, and our statistical expert, measurement specialist, whose support is really great in getting all this data today across you all. And Dr. Annie Smith is also a co-investigator and research director at McCready Center Society, who collects BC Adolescent Health Survey. So I want to really acknowledge and thank them for giving us access to BCHS. As Sushi mentioned, I would also like to acknowledge our funders, CIHR and CFREF, to support this work. I like to start with the background. So, adolescents who are lesbian, gay, bisexual, queer, and questioning youth experience significant challenges or health disparities when compared to their heterosexual peers, which can range from experiencing more victimization, in extreme cases, more violence, which all leads to poor health outcomes among them. To understand these disparities, the intersectionality theory by Kimberly Crenshaw highlights how multiple forms of identity can put additional stressors on youth, which is such as race, gender, and sexuality, and it intersects to shape unique experiences of oppression. And as you will see in the presentation today, we are talking about a group which is at this intersection of ethnic minority and sexuality, and they deal with two minority statuses, putting them to increased stress. But despite these negative experiences, our research at CERAVIC and also additional research says that there are protective factors and resilience factors that foster healthy development among youth, for example, like social support, that can definitely help youth to moderate some of the negative mental health outcomes associated with these negative experiences. Stigma experiences can manifest as discrimination in basic needs to social rejection, negative comments, bullying, harassment, and it's violence, assault, physical, verbal abuse, and exploitation. And all of these experiences are found at higher prevalence among stigmatized groups because these experiences are part to the stigma associated in today's case with orientations that are not exclusively heterosexual. So for our sexual minority youth, and all these contribute as enacted stigma, which then influences various health outcomes. With this background, today's presentation will first talk about what is the prevalence of suicidal ideation and attempt, which are two adverse mental health outcomes among South Asian sexual minority youth and compared to their heterosexual peers. We will then try to understand whether these stigma experiences have a link with suicidal outcomes among this group. And finally, we'll try to understand whether there are protective factors and they come under the social support are associated with lowering the odds of suicidal thoughts and attempts among South Asian LGBT youth and their heterosexual peer. Um, because of the limited time today, I will be just presenting most of the findings among South Asian LGBT youth. So for this study, we use a 2023 BC Adolescent Health Survey, which is a province-wide survey of youth health risk behaviors and protective factors of health development. This survey uses a cluster sampling design to obtain a representative sample of students from grade 7 through 12. In the recent cycle of BCHS, which was collected in 2023, there were across 840 schools and 58 school districts. So around 40,000 students participated in the recent cycle. For today's study, we are including youth who self-identify themselves as South Asian and also reported their sexual orientations. And so the total sample for today's presentation is around 4,364 youth. As you can see, we had heterosexual girls, boys, and compared them to their LGB peers. And the mean age of LGB youth was 15 years, and mean age of heterosexual youth was 14.7 years. We also wanted to see how many migrants are there among South Asian. And so this sample had 27% of youth as South Asian youth as migrants, those who were not born in Canada. To answer our research questions, our outcomes were these adverse mental health outcomes, suicidal ideation, and suicidal attempts, which were measured by asking youth whether they had considered suicide or they attempted suicide in the past 12 months. To calculate our enacted stigma, we created an index. As I explained in my second slide, their enacted stigma is forms by different types of violence and discrimination. So to measure that, the enacted stigma index was created by summing the number of reported experience of wide range of harassment, bullying, discrimination, and violence. So we had almost around 10 different discrimination and violence experience, which range from discrimination based on ethnicity, sexual orientation, gender, disability, physical appearance, and then sexual abuse, physical abuse, bullying, cyberbullying, and harassment. And we dichotomize enacted stigma by first looking at total mean and standard deviation, and then we separated those above and below to standard deviation from mean. So to put it in simple terms, how we dichotomized youth who had 3 or more enacted stigma, and then youth who had less than 3 stigma experiences. We had we tried to see the 5 protective factors, which were school connectedness, so how connected they felt to school, to their teachers. Similarly, we had family connectedness, how connected they feel to their family, their mother, their father, are they being cared by their family? We had school safety, which we had while at school, how safe they feel at different places in school. For example, classrooms, washroom, changing rooms, library, hallways, cafeterias, and school ground. And then we asked about whether they had any caring neighborhood adult, and also kind of ask about their friends. All these represent different social supports that youth needs for healthy development, and we wanted to see whether these protective factors protect them against these adverse mental health outcomes or not. In the interest of time, I'm not going in details about this school connectedness, but I will share our email later. So if you want more details on them, we can share it with you. To answer our research question, our analysis plan was first we compared the prevalence or proportion of youth who said yes to suicidal ideation and attempt, and then compared by chi-square test, which is a test we do at an SPSS to see whether these outcomes were different between LGB and mostly heterosexual youth. And mostly heterosexual youth. And then to see whether enacted stigma or these stigma and discrimination experiences and protective factors are associated with these suicidal outcomes. We did this regression models, which help us to understand these associations. Further, we also did an interesting analysis, which is called probability profile. In simpler terms, what really probability profile helps us to understand is that with different permutation and combination of enacted stigma and protective factors, for example, if a youth is experiencing high enacted stigma, and if he has all the protective factor, or if they have no protective factors, so all these different combinations we see, and then we try to see what is the probability probability of suicidal ideation and attempt among them. You can see a very complex formula here where we put it in Excel and kind of calculate those probabilities. When I'll present the result of probability profile, this will later on make more sense. But happy to answer any question on this analysis. Coming to the results, so for a suicidal ideation and attempt, as you can see in these bar graphs, LGB youth reported significantly more suicidal ideation and attempt when compared to their het peers. So if you see suicidal ideation among boys, proportion of LGB youth who reported suicidal ideation was 28.7% in BCHS 2023 compared to 6.2% of het boys reporting that. Looking at same suicidal ideation among girls, LGB girls reported 36.1% of LGB South Asian girls reported of having an ideation of suicide compared to 12.6% among their heterosexual peer. Coming to our next outcome, which is suicidal attempt, again, we see 8.3% of LGB girls, LGB boys reporting suicide attempt compared to 1.4% among their het peers. And all of these differences were significant. Again, in the end, if we see suicide attempt among girls, 7.8% of LGB girls reported attempting suicide compared to 3.4% among their het peers. Now, these are the results where we tried to look into using the regression models in SPSS, whether there is an association between our predictors like our risk factor, which is enacted stigma, and our protective factors with our outcome, which is suicidal ideation. And so first we did bivariate analysis, which basically is we entered just one factor. So we just entered enacted stigma and saw whether there is an association between stigma and suicidal ideation among girls or not. And so we had these 6 different models. Coming to, if you see enacted stigma result, what odds ratio basically is telling here is, and if you can see the 2 stars basically significant that it is significant, that means girls, LGB girls who had 3 or more stigma experiences were 4.2 times more likely than LGB girls who had 3 or less enacted stigma experiences to report suicidal ideation. So you can see how these results points out to enacted stigma being a strong predictor for suicidal outcomes among LGB girls. As I mentioned before, in the interest of time, I'm just representing LGB youth results here, but I had similar results among het girls and boys as well. When we try and see what are the other protective factors for suicidal ideation, we see if the odds ratios are less than 1, that means they are protective. So they are reducing the odds of suicidal ideation among girls. So if you see all the odds ratios of these social supports like family, connectedness, school safety, caring neighborhood adults, close friends, all are less than 1. But if the odds ratios are less than 0.50, it just shows they have a strong effect or they're strong protective factors. So out of all the different protective factors, the strongest 3 protective factors were family connectedness, and school safety. And why I'm saying top 3, because those were the one which we will then see in our probability profiles later on. Similar results we saw among suicidal ideation for boys, where when you have enacted stigma to see whether there is they increase the odds of suicidal ideation, you can see it's almost 11 times more if a youth experiences more than 3 stigma experiences compared to youth who had less than 3 stigma experiences. So again, it just shows that among boys as well, it is such a strong predictor. Again, in this models as well, family, school, and school safety were the strongest protective factors against suicidal ideation. When we come to suicide attempt, similar results. We had enacted stigma as and family connectedness, school connectedness, and school safety as the strongest predictor. I'll go now to the probability profile. So looking at these bivariate analysis, which helped us understand, yes, stigma is a strong predictor, and our three top protective factors were family connectedness, FC, school connectedness, SC, and school safety, SS. So using probability profiles, what we got is we have different combination of stigma. So we have LGB girls who were experiencing high stigma against LGB girls who had low stigma. And you can see that if we have zero protective factors and high stigma, the probability of LGB girls reporting suicidal ideation is 80%, whereas even if with high stigma, they have all these social support, the probability of suicidal ideation drops to 9%, which just shows how important these social supports were. Which you can similarly see if they have less stigma experiences, they still have 65% probability of suicidal ideation. But when they have all protective factors, it drops to 4.3. Another results that I really want to highlight here is family connectedness, which is this graph, which shows that even if they have high stigma, they have no other protective factors, just family connectedness alone. Even with high stigma, it protects them against suicidal ideation. It drops it to 19% probability of suicidal ideation among LGBT plus girls, which shows the importance of family connectedness among girls, South Asian girls, and boys as well, because we saw similar results where all protective factors drop the probability of suicidal ideation, even with high stigma experiences, from 83% to 5%. And again, we saw very strong protective factor coming out as family connectedness. But let's not forget the importance of school connectedness and school safety as well, which helped in reducing the odds of the suicidal ideation. Ideally, we want our youth to have no stigma experiences and all these social supports with them to protect them against these adverse mental health outcomes. So I will now, so all the suicidal attempt models were also pointing out to similar results. We also tried to see another intersectionality of being a migrant youth. As we all might know, South Asian represent one of the largest visible minorities in Canada. So I also saw whether there were any differences between migrant and non-migrant youth among South Asian LGB youth. But based on our basic analysis, there were no significant differences between the two groups. So they both reported similar suicidal ideation attempt. And why I'm presenting it now is because as part of our project, we will also be doing some deeper dives to seeing difference between migrant and non-migrant youth. So stay tuned. In some future webinars, we will be presenting that data as well. To sum everything up, I also wanted to share quickly some of the recommendations that South Asian youth themselves made, which really aligned with the quant results or the numbers we were just seeing. For example, we saw family connectedness as a strong support system in the quantitative analysis. Similarly, our South Asian youth, when they were making recommendations how to make their coming out experiences good or better in Canada, one of the top things they were talking about is family acceptance. And one of the youth said, I think parents are a bigger factor than school when it comes to individual acceptance. And it was a 21-year South Asian migrant youth. Another LGB youth here who said like they were a migrant and they said relocating to Canada has fostered a more inclusive social environment for them. And that was one of the reasons of being to migrate to Canada. But they did share schools tend to be more Eurocentric, which just shows that we need greater cultural acceptance, which includes more representation from the South Asian community. So these recommendations are from South Asian youth in Canada, which aligns with what the numbers of BCHS 2023 is also saying. To summarize everything I said today, the experiences of stigma are the strongest predictors of suicidal outcomes for our South Asian sexual minority youth. But in spite of this stigma, there are protective factors. We can do something about it. Strong family relations, sense of school belongingness, and sense of school being safe can really help our youth against these adverse mental health outcomes. And so these findings affirm the need for policies and programs that assist schools and families in supporting youth from multiple minority groups. As our commitment to do further research, we are also trying to see whether these inclusive policies work, like SOGI 123, having GSAs and school inclusive policies work for South Asian youth or not. As Elizabeth in the past, in the webinar last month, shared how they were working for all the youth, including heterosexual youth, along with LGB youth. We are trying to do similar analysis to see whether it works for ethnic minority youth such as South Asian or not. So stay tuned for that as well. Thank you very much for your attention.
Thank you, Monica, for such an insightful presentation. I know I learned a lot. And as she said, we'd like to open the floor up for any questions and answers. You can raise your hand or directly unmute yourself and speak, or even drop your questions in the chat, and I'll be happy to read them aloud.
Or any comment, anything, yeah, if not a question.
Yeah. Yeah, I don't see anything on the chat yet. Seems like you were pretty clear, Monica.
Or I spoke too much. I don't know, either of those.
Well, if we're waiting for other folks to ask any questions or comments, I would just like to chip in that the probability profiling approach that was used in this particular study is one that we've used a lot over the years. And what I really like about it is we know that one young person isn't going to have all the same, like the strongest risk factors or the strongest protective factors. They may not have all of them, but they may have some of them. And this ability to actually look at the, different combinations of those risks and different combinations of those protective factors and what that does to the probability that someone has a negative outcome can be really helpful in being able to help clinicians or social service workers who are recognizing that these are the strong ones and people need to pay attention, but it does it does raise that question of, but not everybody has all those. So what do you do if they don't have strong family connectedness? Guess what? School helps. Okay, what if the bullying is happening at school? Well, family support is important. So that ability to look at the combination can be really beneficial.
Thank you. Thank you, Elizabeth. I have a question in the chat, and then I know Ranjit also has her hand up. I'll read the chat one first. Does the study hold the possibility of extending the research to gender minorities in South Asian youth now or in the future, that is beyond sexual minorities?
Hi, Reg. Thank you for asking that question. I would love to do that. Unfortunately, just because of the power or the sample size in BCHS 2023, we didn't have enough South Asian youth kind of reporting or saying that they are gender minority or trans youth. So we didn't have enough sample size for them to be able to do it. But yes, I would love to kind of do that maybe in future BCHS 2023. But if not, that's something we can always kind of do as a qualitative study to understand their experiences.
Thank you, Monica. Ranjit?
Yeah, hi, Monica. Thank you so much for a very informative presentation. I found it really great data sharing. So that's the question. What are the next steps? What's the plan in terms of sharing this data with the community? Do you have some plans around that?
Yes, and thank you for asking, Ranjit. So one of the things that we have done as part of the CIHR grant for South Asian youth is we have South Asian advisories. We have both for youth and for adults where we kind of I have kind of been consulting them throughout this project, so that I can share this research with the community so that I'm able to get guidance on how, where, and what language really they would like me to kind of create using this research. So I will be working with our South Asian advisories to do that. As next steps, as I was sharing, I have few more research questions to answer. For example, how different it is for migrant youth. And additionally, I also want to see through our multi-level modeling techniques, LEFI, which will help us try and understand whether these inclusive school policies like GSA SOGI 123 work for South Asian youth or not. So along with all this information, I aim to create infographics, community-friendly report, but with consultation with our South Asian advisory. McCready Center Society is also helping us in creating some infographics so that we can share it in the schools as well, because this is a school-based data, so we would like to go back to schools and share it with South Asian youth. So these are, in the nutshell, what I'm looking forward to do, along with presenting and sharing these results with our researchers as well.
Great. Thank you.
Thank you, Monica. If there are no other questions, I would just like to remind everyone that I dropped the sign-up form for our newsletter where we keep everyone updated about our next webinar sessions and we send quarterly insights as well. So thank you again, everyone, for joining us. Monica,
I've
if you
also
have...
put our SARAVYC email. So if you have any questions, maybe about our study, research, any question on methodology, want to see any further research, please feel free to email us. Thank you. Thank you, everyone.
Amazing. Thank you.